hovered over me, the chestnuts fell and open to reveal the smell of mystery. Bloodbush burning amber, leaving ashes in my veins. Dark-skinned boys throw houses.
Hi, my name is Amina. I'm a naturopath in Noosa on the Sunshine Coast of Australia. I've been treating Lyme disease for over 4 years now, and I'd like to share with you how naturopathy can help yourself or someone you may know with this debilitating disease. Lyme disease is a vector-borne disease caused by the spirochete bacteria Borrelia burgdorferi, but there are also a number of other strains of Borrelia. One of the main ways of catching Lyme disease is from ticks. There are also a number of co-infections associated with Lyme disease, such as Mycoplasma, Bartonella, Babesia, Rickettsia, Anaplasma, Chlamydia pneumoniae. Lyme disease can be successfully treated using naturopathy in conjunction with conventional medicine. The naturopathy is really important in treating Lyme disease to support the immune system and also a number of other systems, the endocrine system, the nervous system, the digestive system, the detoxification in the liver, and also to generally tonify and strengthen the organs so that the body is healthy and is able to combat the Lyme disease. So when we look closer at addressing the Lyme disease symptoms, we will be looking at the immune system and providing herbs that are antimicrobial, anti-inflammatory, alkalizing for the body. We're supporting the body's detoxification pathways by helping get rid of the toxins, the endotoxins, the die-off of the bacteria. We need to support the gut and any gut dysbiosis, so looking at the bacteria that may be imbalanced within the gut, such as E. coli, Streptococcus. There are a number of other bacteria that need to be addressed. And looking at the whole body as a whole, we treat each system individually and make sure that the patient has a complex treatment plan. When I'm treating as a naturopath, I always look at the patient's constitution or their terrain, which is the way their body is, the strength of their body. When we're looking at the terrain, we need to make sure that all of the systems of the body are addressed. So the immune system, the digestive, the endocrine system, all has to function really well together with detoxification, of eliminating toxins out of the body. So if there's something out of whack, hormones or too much inflammation in the body, too many toxins like heavy metals, or the bacterial overgrowth that needs to be addressed, we need to work on that so we get the whole of the body terrain fixed up. It's like a mosaic of the body. We need to get every piece or every piece of the jigsaw puzzle together so it all works better. Some patients may not be able to tolerate antibiotics at different stages of Lyme disease. That's okay, so we can work with that and we can support the immune system and strengthen the immune system, doing whatever it is we need to do until they're able to get back on track. We just can work well with antibiotics, or if we need to, we can work well alone. Some people may not be able to tolerate antibiotics because they may have had a lot of antibiotics in the past. They might have a lot of gut dysbiosis, which means the bacteria in the gut is all out of whack, out of balance. So until we get that fixed up, any other antibiotic is going to probably just make them feel a lot more sick and they get a lot more side effects. So when a patient can't tolerate certain medications, then we can just strengthen their immune system and get them into optimum fitness before we continue with the treatment protocols. The herbal medicine can help support the antibiotics by strengthening the immune system, but also can help minimize the side effects of the antibiotics. And we also need to address the endotoxins, which are the toxins that are produced from the bacteria when the bacteria are dying off. So naturopathy can really help get rid of those toxins and increase detoxification of the body, which is the detoxification is the body's own way of eliminating the toxins, getting the toxins out of the body. I specifically treat Lyme disease with looking at the person's own constitution. So we go through the most debilitating symptoms and I'll treat those areas first, but also in conjunction make sure that the immune system's treated with antimicrobial herbs, the anti-inflammatory, also making sure we support the gut, so any probiotics that the patient may need. I always address adrenals, so looking at the endocrine system, see what other hormones may be out of whack. The adrenal glands often need treatment. There's a lot of stress on the body physically and mentally that often comes with Lyme disease. I always look at the nervous system. The nervous system will create symptoms such as anxiety and palpitations and brain fog if not addressed. So I always address those different symptoms as well. So with acute Lyme, when a tick bites a patient, it releases certain chemicals into the blood and it actually creates a cascade of inflammatory cells. So basically the body is a lot more likely to have a lot of inflammation, and that's going to trigger the immune system, and that's what really helps the Borrelia bacteria to survive in that inflammatory type state. So the herbal medicine can really help tone that inflammation and to make the environment not conducive for the bacteria, so the bacteria won't want to survive in that area. So in chronic Lyme, often the patients have a lot more adrenal exhaustion and fatigue, so we need to address that, and that can be very, very effectively treated with herbal medicine, directly treating the adrenal glands. Also, when patients have chronic Lyme, they often have the bacteria has gone to different stages, so the cystic form, for example, can be treated with proteolytic enzymes. I might use digestive enzymes to start and then actually use the proteolytic enzymes like serrapeptase later on. And that'll also address the biofilms and bacteria that's in more difficult places to get to. Herxing is a Herxheimer reaction, which is a die-off reaction due to the bacteria being treated. So if someone starts taking antibiotics or herbal medicine, once the bacteria start dying off, they release toxins, and that can actually make the patient really, really sick. And often the symptoms are exacerbated, which means they get a lot worse. So what we can do then was use certain herbs that will help alleviate the Herx, and by detoxifying the body, we can get rid of the toxins out of the body in a safe and healthy way. That means that the patient will get a lot better, a lot quicker. Detox is the body's way of getting rid of toxins, so actually eliminating the toxins and the debris out of the body that our body doesn't need. So through the liver we detox, through the kidneys, through the skin, through sweating. So there's a number of ways that we can actually help the body eliminate, get rid of the toxins out of the body that are making us sick. Detoxing is very important when you have a debilitating illness such as Lyme disease, because if you don't detox the body and get rid of the toxins or the die-off of the bacteria, the body can get really sick. And what can happen is the toxins can actually affect the cells. So on a cellular level, the patient's going to be finding it a lot hard to thrive. And also the toxins will affect the organs. So all of the organs of the body, and create a lot of inflammation. So the body really needs to have the help to get rid of the toxins out of the system through a safe detoxification pathway. Toxins can be caused by anything. There can be toxins in food, chemicals, preservatives, medications. Our body will produce its own toxins. For example, athletes that are producing a lot of lactic acid, it all becomes toxic in the body. So toxins are just substances in the body that will affect the body in some way, and we need to get them out of the system as safely as we can, so that the body has much more of a greater chance of thriving and achieving optimum health. When you're getting treated for Lyme disease, your body holds on to a lot more toxins because the elimination pathways are more challenged. So it's really good to have that extra bit of help just to help get rid of the toxins out of the system. Well, all Lyme patients have their own symptoms. Not every Lyme patient has the same symptom picture at all. So some patients may have more sort of inflammatory type arthritis symptoms. Some are more the neuroborreliosis type symptoms, where they're getting affected with the nervous system and the brain fog, migraines, seizures. Some patients tend to have more digestive symptoms. So when I'm treating Lyme disease, we look at the main patient's picture and work out what is the most debilitating symptom. And of course there's lots of symptoms that will overlap. Some patients end up getting most of the symptoms altogether, but it just depends on the patient. So I really work on personalised programs to work on the most patient's debilitating symptoms. It's essential for patients with Lyme disease to seek naturopaths that are Lyme literate naturopaths, as there are a number of complexities within the disease that do need to be addressed. It's essential to know what types of antibiotics are used with Lyme disease, to know exactly what your patient's on, and to know the side effects, and to be aware of the doses, as well as the dose changes. Often patients are having different dosages each week, and they may have 1 week on and 1 week off of different medications, so it's really important to keep up to date with exactly what the patients are being prescribed, so we can work in conjunction and prescribe accordingly. Herbal medicine and nutritional protocols are absolutely essential in treating Lyme disease, and that way we have all the nutritional deficiencies addressed and any of the imbalances of any of the major systems. So it's really, really important to work in conjunction with the conventional medicine in order to treat the Lyme disease in the best possible way.